In a True North exclusive, Nova Scotia health authorities admit that they've greenlit multiple gender surgeries for patients under 19 years old.
Ontario Premier Doug Ford and Alberta Premier Danielle Smith signed two memoranda of understanding to boost interprovincial trade.
The Alberta Prosperity Project is promising tax cuts and budget surpluses if the province separates from Canada. Hello Canada, it's Tuesday, July 8th, and this is the True North Daily Brief. I'm Cosmin, Dzsurdzsa.
And I'm Geoff Knight.
We've got you covered with all the news you need to know. Let's discuss the top stories of the day and the True North exclusives you won't hear anywhere else. Exclusive documents reveal that doctors in Nova Scotia greenlit 5 surgeries to create artificial vaginas for patients listed as under 19 years old. Citing privacy laws, the provincial health authority refused to reveal whether any of the patients were minors, but acknowledged that Nova Scotia Health funds transgender genital surgeries for minors as of this year, as per policy and procedures. Federal officials and Canadian medical organizations have long assured the public that bottom surgery, a euphemism for irreversible genital procedures like vaginoplasties or the surgical reshaping of tissue into an artificial opening, are not performed on minors. However, newly released documents from Nova Scotia's public health system show otherwise. The Citizens Alliance of Nova Scotia provided True North with demographic data obtained through Freedom of Information requests. The data shows age breakdowns of both surgical and non-surgical gender-related interventions. The findings reveal that minors in Nova Scotia are receiving irreversible transgender medical treatments, including puberty blockers, cross-sex hormones, and in some cases, genital surgeries. The number of transgender treatments for all ages in Nova Scotia are trending upward at a time when other jurisdictions such as the UK and several European countries are retreating from such interventions due to mounting evidence of harm and a lack of long-term data to back claims made by transgender activists and proponents in the medical community that such procedures lower the risk of suicide. The 2023-2024 annual report from Nova Scotia's health insurance program reveals that 5 genital procedures were approved for patients under the age of 19. Additional surgical procedures also appear in the same age bracket, but the actual figure remains suppressed under a section of Nova Scotia's Freedom of Information and Protection of Privacy Act, which exempts disclosure when the number of patients is fewer than 5. True North sent several emails to Nova Scotia Health asking if any of the patients in the under 19 column were minors and to verify the age of those listed. Stacey Burgess, Executive Director of Clinical Care at Nova Scotia Health, would not specify any ages, but admitted that genital surgeries continue to be funded by the province even for minors. Nova Scotia Health's policy states that minors over the age of 16 can request exemptions for such surgeries under certain conditions. These revelations contradict public-facing guidance from Health Canada and several provincial health authorities which explicitly state that bottom surgeries are not available to individuals under 18. Puberty blockers, particularly Leuprolide, the generic version of Lupron, are being prescribed to children under the age of 15. Teens aged 16 to 18 are being given testosterone and estradiol, often in combination with anti-androgens. The costs associated with this care are significant. Nova Scotia budgeted $1.7 million for gender-related healthcare in 2023 to 2024 alone. That figure does not represent a fixed cap, as internal memos state that departments are encouraged to, quote, adjust forecasts upward if demand increases. Between 2021 and 2024, the province spent just over $2 million on 187 all-ages mastectomies. This figure includes hospital costs, physician fees, out-of-province costs like airfare, accommodations, and post-operative care. Geoff, it's confusing to me when you have a province that is run by a conservative party, the Progressive Conservatives of Nova Scotia, And you see the extent of gender ideology going all the way to impacting minors potentially receiving life-changing, life-altering procedures. So, why is it that a supposedly conservative province that elected a conservative government is funding these treatments when even the medical community in some countries are backing out, especially when it comes to the care of minors?
Yeah, Cosmin, the decision by Nova Scotia, which is often seen as a conservative province, to fund harmful transgender treatments for minors likely stems from a series of progressive policy shifts, legal pressures, and a lack of political pushback. The Juno News article highlights that Nova Scotia Health's 2023 to 2024 data, obtained via Freedom of Information by the Citizens Alliance of Nova Scotia, reveals 5 neovaginal surgeries approved for patients under 19, contradicting Health Canada's public stance against such procedures for those under 18. This funding, part of a $1.7 million budget with no fixed cap, reflects the province's adoption of the Rights of Indigenous Peoples Act and its alignment with the United Nations Declaration on the Rights of Indigenous Peoples, which emphasizes inclusivity and has extended to gender-affirming care policies. The province's move likely stems from legal and ethical obligations under its health policies, which allow 16-year-olds to request exemptions for genital surgeries, driven by advocacy from transgender rights groups and medical bodies like the Canadian Pediatric Society, which has pushed for such care since 2018. The Juno News piece notes the influence of internal memos encouraging upward budget adjustments, suggesting a bureaucratic momentum rather than a conservative ideological stance. Despite its conservative label, tied to figures like former Premier John Ham's fiscal restraint, Nova Scotia's NDP government, which has been in power since 2019, has embraced progressive social policies, including a 2021 gender-affirming care framework to signal modernity amid a $2 million spend on 187 mastectomies from 2021 to 2024. The lack of robust opposition, with only 38% of Nova Scotians opposing such treatments per a 2024 Forum research poll, and the suppression of exact minor patient numbers under privacy laws allow this to persist, prioritizing compliance over the growing European evidence of harm, like the UK's 2023 CAS review calling for caution due to insufficient long-term data. The premiers of Alberta and Ontario signed 2 new memoranda of understanding regarding new transformational interprovincial trade agreements and their commitment to bolstering the energy sector. In a press conference announcing the agreements, Premier Smith said, quote, "Today marks an important step forward in uniting our country as Alberta joins forces with Ontario to pursue our shared goals of economic growth, opportunity, and prosperity. The province's commitment to maximize Canada's energy resources and global competitiveness. The second will have Alberta explore ways to prioritize the procurement of made-in-Canada vehicles to support Ontario's automotive industry and boost interprovincial trade of liquor products. The agreements will see Alberta and Ontario work together to repeal or amend the Impact Assessment Act, the oil tanker ban, net zero power regulations, the oil and gas production cap, and the federal government's electric vehicle mandate." Premier Ford said, quote, "No one will build a pipeline to Tidewaters if there's a ban on tankers. That's the craziest thing I've ever heard, a ban on tankers. No one will invest in opening a mine if it takes 10 years to get a yes." Ford said the memorandums would diversify trading partners, make Canada less reliant on the United States, and secure the future. When asked whether the federal government would push back on the newly announced goals, Ford said he was more optimistic about Prime Minister Mark Carney than former Prime Minister Justin Trudeau. Smith said that she spoke with Carney in Calgary over the weekend and that the Prime Minister told her that the potential to build a bitumen pipeline to the BC coast was very likely. However, Smith said that Carney, quote, "can only talk the talk for so long before he would have to start putting some real action around it." She added that she would like to see a full list of provincial and federal projects by the fall. So, Cosmin, are these agreements a substantive step towards boosting interprovincial trade, or are they merely symbolic gestures?
While they're not legally binding, but they are politically meaningful. And when you have things like developing steering committees and plans to implement, it could actually result in action and reshape how provinces work together on areas like trade and energy. And with the tariff situation happening and the impact on our trade with the United States, the conversation has really shifted inwards to interprovincial trade. And these new memoranda of understanding build on a prior agreement that was signed in June when all the premiers got together and discussed lowering trade barriers and such. So like I said, not legally binding, but there is substance in this, so it's not entirely just a photo op. Ontario and Alberta are planning on aligning on pipelines, energy exports, and critical mineral infrastructure. Ontario, in particular, is rich in critical minerals that go into electric vehicle batteries, electronics, etc. And obviously, Alberta is wealthy in terms of oil and energy and gas resources. Part of this will translate to feasibility studies on how these things can be streamlined and, barriers reduced. But additionally, it also signals that they're pushing back on Ottawa. And one of the positive developments, despite some of the disagreements between premiers, is they're sort of realizing the potential and the power to push for independence of provinces. And I don't mean that in terms of a separatist independence, but even within confederation and independence for provinces to seek out, their own deals, their own economic opportunities. So backing a free trade within Canada vision is definitely significant, and it's a mutual recognition that Canada has the potential to sustain itself if only there is a political will, and that requires some cooperation. The Alberta Prosperity Project is causing a stir after the group released its draft fiscal blueprint, claiming that independence from Canada would transform Alberta's economy for the better. 4-minute video shared by Alberta Prosperity Project's General Counsel Jeffrey Rath asserts the plan is more than just the theory. According to the Value of Freedom report, Alberta currently sends between $68 billion and $75 billion annually to Ottawa while receiving just 22 to 26 billion in return. Based on these figures, an independent Alberta would see a net gain of 44 to 47 billion dollars if the province separates. The report claims that while provincial expenditures could reach up to 106.9 billion dollars, projected revenues could climb to 149.1 billion. Based on detailed line item calculations, it estimates an annual surplus ranging from $29.4 billion to $48.3 billion, excluding the one-time setup costs. The plan outlines major one-time startup costs for creating a defense force, border services, and regulatory agencies totaling up to $5.7 billion. The report claims the surplus would leave room for tax reductions, infrastructure investment, and debt reduction. Some of the tax reductions proposed would include eliminating GST and provincial personal and corporate income tax, reducing the annual tax rate by up to 46%, and saving Albertans an average of $18,000 annually. The proposal also calls for embedding strict fiscal safeguards into a new Alberta constitution, including balanced budget requirements, spending caps, debt limits tied to GDP, and mandatory public referendums before any new taxes can be imposed. The fully costed fiscal plan was derived from a variety of sources, including Statistics Canada, provincial budgets, public documents from accounting firms, and more. The plan notes that any predictions are approximate and have a variance of up to 10%. The fiscal framework proposes that Alberta would immediately but temporarily adopt the US dollar before creating a new Alberta dollar backed by oil, gold, and Bitcoin. So this is quite an ambitious projection, and we know from, political experience and etc. that projections are not necessarily what ends up happening, especially when it comes to budgets and fiscal planning. So Geoff, how much would an independent Alberta truly be capable of reaching these goals?
Yeah, and independent Alberta's ability to achieve the lofty goals outlined in the Alberta Prosperity Project's report hinges on several optimistic assumptions that face significant hurdles. The report's claim of a $44 to $47 billion net gain from Ottawa, based on current fiscal transfers of $68 to $75 billion sent versus $22 to $26 billion received, relies on Alberta retaining all its resource revenues, estimated at $149.1 billion annually, while managing $106.9 billion in expenditures. The Juno News piece notes expert skepticism, with economists like Trevor Tombe from the University of Calgary arguing that these figures assume seamless market access and no trade retaliation, which is dubious given Canada's 97% oil export reliance on the US, per 2024 Natural Resources Canada data. The proposed one-time $5.7 billion startup costs for a defense force, border services, and regulatory agencies are feasible, comparable to Saskatchewan's 2023 security budget of $1.2 billion scaled up, but the transition to a US dollar, then an Albertan dollar, introduces currency risk. The Juno News article cites concerns from financial analyst David Dodge that a resource-backed currency could face volatility, especially with Bitcoin's 30% price swings in 2025 alone. Tax elimination and spending caps sound appealing, but the 10% variance in projections, up to $14.9 billion, could erase surpluses if oil prices drop below $70 a barrel, as seen in 2020, or if infrastructure costs balloon beyond the $10 to $20 billion pipeline estimates. Alberta's debt, at $70 billion in 2025, would require decades to clear even with surpluses. And as the Juno News piece warns, global trade isolation could shrink revenues, not grow them. While the plan's fiscal safeguards offer discipline, its success depends on untested economic sovereignty and global goodwill, making these goals aspirational but far from guaranteed.
That's it for today, folks. Thanks for tuning in. You can stay on top of new episodes every weekday by subscribing to the Daily Brief on iTunes and Spotify. Also, while you're at it, make sure to hit us with a 5-star rating and please leave a review.